Joining us. Good morning, everyone. Thank you for joining us. We will begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. We are also joined this morning by Charlene Oliver, Founder and Board President of the Equity Alliance, who is here with us to talk about Census Day 2020. Chief Steve Anderson of the Metro Nashville Police Department is here with us to help answer your questions, as is Chief William Swan of the Office of Emergency Management and Nashville Fire Department. We will now begin with Mayor John Cooper.
Good morning, Nashville. Yesterday morning at the State of Metro address, I announced that the Metro Public Health Department, at my direction, would be extending the Safer at Home order until April 24th, consistent with the statewide schools closure. Now, all residents should continue remaining at home, except when running errands and avoiding social gatherings at all costs. All non-essential businesses will remain closed, while essential businesses and institutions, including government public safety offices, grocery stores, banks, and restaurants offering pickup and delivery, will continue to serve the public. The order will also be further amended to protect residents as they run essential errands and the employees who are working at this time. Dr. Jahangir will provide more details about these changes. Our thoughts remain with all those who are sick, and we extend our condolences to the loved ones of those who have died. Over the past week and a half, our city has seen widespread compliance with the Safer at Home order, and Metro has relied on public education, awareness, and warnings when infractions were discovered or reported by the public. Nashville is at a critical time in our city's response to this disease. An effective response can save thousands of lives. Metro departments are coordinating to take measured but appropriate actions to enforce our Safer at Home public health order and keep our residents safe. You can report suspected violations of our Safer at Home order by anyone who's not supporting our healthcare providers or our community. Report violations by calling 311 from within Davidson County, visiting hubnashville.nashville.gov, or use the Hub Nashville 311 app. Now, 10 enforcement teams, each consisting of 1 or 2 health department inspectors and a Metro police officer, will investigate reports of Safer at Home order violations, and will respond with measured enforcement protocols to include misdemeanor citations and fines as permitted by Tennessee state law. Metro Legal will operate under its authority to file nuisance actions and seek temporary injunctions and padlock orders for non-compliant businesses. And Metro boards, commissions, and departments with permitting and licensing authority may revoke or suspend permits in addition to imposing civil penalties. By flattening the curve of COVID-19, we support our local first responders, help our frontline healthcare providers, and save lives by working together. I'm grateful to Chief Steve Anderson of the Metro Nashville Police Department for joining us this morning to answer any questions about enforcement of the Safer at Home order. Now, this morning, the 3rd Community Assessment Center opened in Antioch near 2491 Murfreesboro Pike. Additional assessment centers are located at Nissan Stadium in Lot N and at Meharry Medical College at 918 21st Avenue North. Hours of operation for all 3 locations are 9 a.m. to 3 p.m. Monday, Wednesday, and Friday until further notice. Now, before visiting a community assessment center, residents must call the COVID-19 hotline at 615-862-7777. So let me say that again, 615-862-7777, between 7 a.m. and 7 p.m. Monday through Friday, to receive an initial assessment by a public health professional, and I'm grateful to all of those who have called. Today, April 1st, is also National Census Day. And although here in Nashville we are recovering and rebuilding from the March 3rd tornado and confronting the coronavirus challenge, I urge everyone to take a moment to visit my2020census.gov or call 1-844-330-2020 to participate. This year, more than ever, Nashvillians must be counted. The census determines how the federal government spends billions of dollars in communities nationwide, including ours. The more people who get counted in Nashville, the more federal funding we'll receive for schools, hospitals, infrastructure, and other important services. I'm very grateful to Charlene Oliver, founder and board president of the Equity Alliance, for being here this morning to discuss how important it is that every member of every community in Nashville participates in this year's census. Yesterday, I mentioned that our city is in a stormy season, and for many Nashvillians, this season may be overwhelming. If you are experiencing a mental health crisis, there's round-the-clock assistance available through the Mental Health Cooperative's 24-hour crisis line at 615-726-0125. That's 615-726-0125. If you're experiencing thoughts of suicide, you can also call 1-800-273-8255. That's 1-800-273-8255 to speak to a counselor. The call is free, confidential, and available anytime, day or night. The COVID-19 Response Fund has raised $3.16 million as of yesterday, and we are grateful for everyone's generous support. As a reminder, residents can visit covid19.nashville.gov to make a contribution to the fund. You can also visit the website to learn how to obtain direct financial, food, housing, mental health, social service, unemployment, and utility payment assistance from that fund. And now I'll turn it over to Dr. Alex Jahanger, the chair of the Metro Coronavirus Task Force. Thank you very much.
Thank you, Mayor Cooper, and good morning. Here's the latest information on the COVID-19 pandemic in our city. We now have a total of 673 confirmed cases. Yesterday, we also had our fourth death, an 83-year-old gentleman. Our sympathies go out to him and his family. This is an increase, by the way, of 132 cases over the past 24 hours. Now, as I mentioned yesterday, this big increase is partially due to the backlog of cases being reported. So our daily incidence may be a little less than 132, but probably not much. So remember, over 100 people at least were tested positive for this disease just in one day. The patients range in age from 2 months old to 84 years old. Of the confirmed cases, 18 are currently hospitalized. 561 cases are self-isolating at home with mild and manageable symptoms, and 90 individuals have recovered and have been cleared. As the mayor mentioned, today is our third screening site will open. This is part of our larger community assessment system for Nashvillians who are concerned that they may have this virus. If you believe you have symptoms, the very first step is to call the hotline. As the mayor had pointed out, the number is 615-862-7777. This hotline is open 7 days a week from 7 a.m. to 7 p.m., and it is staffed by medical professionals who will answer your questions. And based on your symptoms, they may determine that you need to have further assessment. At that point, they will refer you to either your own healthcare provider or to one of our community assessment centers. In addition to the site at Nissan Stadium at Meharry Medical College, a third site opened today at the old Kmart location on Murfreesboro Pike in Antioch. These drive-through centers have additional screenings, and if you're indicated by medical protocols, you will get a test. Now, our healthcare system in Nashville is working hard to meet the city's needs, and I just want to reiterate that our system further expands on the already hard work that our healthcare system is doing, and it gives our residents another venue to get assessed and if needed, tested for this test. The best way that you can help lower the pressure on the healthcare system, though, is to follow the Safer at Home order. As Mayor Cooper just said, the Safer at Home order has been extended for Nashville until April 24th. Along with the extension, the order has been amended to clarify the list of essential businesses and ensure that there is better social distancing. We are asking businesses where shoppers gather, such as grocery stores, big box stores, pharmacies, convenience stores, to take extra steps to encourage social distancing. Place mats and tape on the floor every 6 feet to identify for customers where they need to stand as they're waiting to check out. Do not allow groups larger than 10 to gather at one location. For your employees, make sure your break rooms are spread apart. And then for elevators in construction sites, no more than 2 individuals should be able to enter an elevator at one time. Furthermore, the Metro Parks Department is taking additional actions to reinforce social distancing by securing playgrounds as well as basketball courts. The amended Safer at Home order will be on our website, covid19.nashville.gov, later this morning. Now, I get all of this may seem drastic, but trust me, these steps are absolutely necessary to ensure that people are keeping apart and not spreading the virus. Social distancing has proven to be the most effective way to combat this virus. And we know humans spread this virus. If it is not an absolute necessity, I need you to stay at home. Listen, this is the most important thing you can hear me say. I'm speaking to you not only as a doctor, but as a son, as a father, and as a husband. We need your help. I need your help. I need your cooperation now, because if you do not, more people will die. And honestly, it hurts me every time I have to stand up here and announce another death, and I know more are coming. I really appreciate everyone's focus thus far, and I really appreciate everyone who is staying home. And those of you who are watching now, you've heard this message, but here's what I need you to do. I need you to share this message with those who are not watching, who have not heard this message. I need you to call your friends, text them, social media, whatever format you believe your friends get, please do that and relay this message. Tell them why they need to stay home. Remind them of everyone that can be impacted if this doesn't happen. I really need you to spread the word, and please don't spread the virus. We really are all in this together, but really only if we all come together and do what I'm asking, what the mayor's asking, what all these other individuals are asking, will we really get over this. I really appreciate all of you, and it is an honor to turn it over to Ms. Charlene Oliver, co-founder and executive director of the Equity Alliance.
Good morning, everyone. Thank you, Mayor Cooper, for inviting me today to provide an update on census operations in Davidson County. Today marks National Census Day. My organization, the Equity Alliance, has been assisting with local Census Bureau operations in Middle Tennessee to ensure an accurate count in hard-to-count areas, particularly in predominantly African-American neighborhoods, where there has historically been an undercount. Our team has been assisting with outreach and education efforts in Davidson, Rutherford, and Montgomery counties. Additionally, the Equity Alliance, along with partner organizations, has been leading crisis response efforts in North Nashville for residents who have been impacted by the March 3rd tornadoes and now the coronavirus outbreak. The 2020 census is underway, and households across the country are responding every day. The United States Constitution requires that for purposes of apportioning seats in the U.S. House of Representatives and apportioning federal funding, we conduct an official count of every person every 10 years. There is no provision for researching, guessing, or estimating this count. You have to respond. It is important that every household participates, even while observing the Safer at Home order. In light of the COVID-19 outbreak, the U.S. Census Bureau has suspended field operations through April 15th to protect the health and safety of Census Bureau employees and the American public. To accommodate the delay, they have adjusted 2020 census operations, extending most phases of the count. The adjusted timeline is as follows. Now until May 1st, census takers will drop off invitations at the front doors of 5 million households. Starting on May 7th, census takers will follow up by mail with households that have not responded yet. And then starting May 28th, if the Safer at Home order has been lifted, census takers will go door to door to interview households in person that have not responded online, by phone, or by mail. Census field operations are expected to wrap up by August 14th, assuming the COVID-19 Safer at Home order has been lifted. Other activities have also been extended, including counting people experiencing homelessness, counting group living facilities such as dorms and nursing homes, and mobile questionnaire assistance centers. People affected by a natural disaster, such as the recent March Lord tornadoes, should be counted at their home residence if they plan to return home, in order to prevent underrepresentation in neighborhoods and communities hardest hit by the storm. College students who are temporarily staying elsewhere while their school is closed due to COVID-19 response should be counted where they usually live when they are attending school. While responding to the census may not seem that important during a crisis, it is important to note that an accurate census actually helps our state and communities prepare for and manage crisis situations. For every person that is not counted in the 2020 census, our community loses out on approximately $10,000 over 10 years. It is more important than ever that households respond to the census as soon as they receive their invitation. Even as we are social distancing, there are several convenient ways to respond. The 2020 census is open for self-response online at my2020census.gov, over the phone by calling 1-844-330-2020, and by paper through the mail. If you respond online, be sure to use the 12-digit census ID found on the invitation mailed to you or left at your door. However, you do not necessarily need to use your 12 census ID to participate in the census. The least prepared option is to do nothing and wait for a census taker to visit your residence to collect the information. When people respond online, by phone, or by mail, it saves our government the expense of sending a census taker to your home. As of today, 36% of Tennesseans have responded to the census online, by phone, or by mail. A couple of points to note. During the 2020 census, the Census Bureau will never ask you for your Social Security number, money or donations, anything on behalf of a political party, or your bank or credit card account numbers. If someone claiming to be from the Census Bureau contacts you via email or phone and asks you for one of these things, it is a scam, and you should not cooperate. Also, there are rumors circulating that responding to the census is in some way tied to receiving federal COVID-19 stimulus payments. That is not true. Your answers cannot be used to impact your eligibility for any government benefits, including any potential stimulus payments. The Census Bureau is bound by the Title 13 of the U.S. Code to keep your information confidential, and every person with access to your data is sworn for life to protect your information. The answers you provide are used only to produce statistics. If you need assistance completing your census or have questions or concerns, contact your local partnership specialist, Najma Ashby, at area code 901-848-7056, or you can call a census questionnaire assistance representative at 1-844-330-2020, or visit 2020census.gov. Thank you.
Thank you, Ms. Oliver. I have some additional details on Hub Nashville, which can be used to report Safer at Home violations. Anyone can download the Hub Nashville app on the Apple App Store or on Google Play, in addition to visiting hub.nashville.gov or calling 311 from anywhere within Davidson County. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Jeremy Finley.
Good morning, and thank you again for taking all of our questions. I wanted to ask, I have a two-part question. The first one has to do with the projected spike that we are, and most of the country are supposed to see by the middle of the month. Is there a great worry right now for bed space and how you're going to respond if the numbers get as high as they think they will by midweek, by mid-month? That's the first part of my question. My second question has to do with healthcare workers are telling us that they are having to wait more than a week for their test results. And the state health department told us yesterday that they can turn the results within 24 to 48 hours if that test is done in the lab run by the state health department. But these healthcare workers are telling us they had no idea that that was an option. So my question is there a concern that healthcare workers are having to wait so long for their test results? Thank you.
Dr. Jungier.
Thank you so much. In regards to surge capacity, as I mentioned yesterday, it is top of mind every day for Mayor Cooper, me, Dr. Caldwell, Chief, and everyone who touches this issue. We are working with our state and federal partners, as well as our local hospitals, to create a plan. There are some plans that are underway that I think will be announced later today, perhaps, by the governor and state. But we are actively coming up with plans. I do share this concern that perhaps later in this month there will be an extra need for hospital capacity, but we're on it every day. As of this moment, we are fine, we being a city. But as I mentioned yesterday, we take care of not just people in Nashville. There are people from all over this region and other states that come to Nashville for healthcare because we have an amazing healthcare system. So yeah, it's something we think about. And yes, we worry about equipment. But as I always mention, it doesn't matter if we have 200,000 vents and 5 million beds. If our curve is not flattened and there's more people sick at one time than the system can tolerate, we're out of luck. So help us by flattening the curve. That's number one. Number two, regarding the question regarding healthcare workers, I can't speak to each healthcare system. I know where I work, it's a priority to test healthcare workers whenever they fall ill, and the turnaround rate at my institution where I'm employed at is quick. But I think it is important for healthcare workers as well as people who deal with vulnerable populations, so nursing homes and group homes and so forth, if there's a concern, to get tested and get quickly turned around with the results. But in the meantime, don't put yourself and your patients in a position that can perhaps jeopardize them. So sorry, I can give you a more definitive answer than that, but that really comes to each system and where they get their tests run. Thank you.
Next, we have Tosin Fakile.
Good morning, Chris. Good morning, everyone. A few questions. I asked this yesterday, and I don't know if we have an answer just yet. Chief Swan told me he was going to look into it. What are we seeing in terms of crime around like Nashville, Davidson County? Is it going up, going down based on the safer at home order? And my other question is, the mayor said there's a little over $3 million in this response fund. Have people started getting money from this, or if not, when is that expected to end? And my final question is, this morning the Kroger in Bellevue had 2 employees that tested positive for COVID. So does the city have something they can do to make the store close, make them do something extra in response to that to prevent the spread? Or I don't know if you guys are doing anything in response.
So Chief Steve Anderson is here to answer the first part of the question.
So we have looked very carefully at the crime trends across Nashville in the last couple of months, comparing them to the same time period from last year. And also we're watching what goes on nationally. So we've not seen any increase in crime that we could attribute to the stay-at-home order, to the coronavirus. We do have some increases in certain categories. Homicide is an example. Obviously, we look at those as a complete number, but we also look at it at individual cases. And so in each case, for the most part, it's people involved in illegal activity are settling grievances that have nothing to do with the present crisis. Domestic violence, we looked at that very closely. We're about even with last year on domestic violence. I know that the YWCA and the Family Safety Center has received an increased number of calls, and that's very good, excellent. People are calling for advice, calling for counseling, and we encourage that. But in terms of our calls for service and what's reported to us, it's about stable from last year. But again, we're open for business, and certainly anybody in need of our services, domestic violence or otherwise, please call. We look closely at the juvenile crime, knowing that schools are out. But it's about even again from this time last year. So to sum it up, we're not experiencing anything that we can see from our analysis that we could attribute to the current stay-at-home or anything to do with the coronavirus crisis.
Thank you, Tosin. And your second question on the response fund. That fund, and it's been very generous, and I'm grateful to people and will be soliciting more money, is being done in partnership with the United Way of Middle Tennessee. Senator Bill Frist is the chairman of that fund, and I look forward to announcements in the future from that. And again, I do want to encourage people to contribute, but right now I don't believe they've made any grants from it affirmatively, but I expect that they will, and there'll be a process, and I'm very grateful to Senator Frist for his leadership in overseeing this fund in conjunction with the United Way. Thank you.
Good morning. Just following up on the question about the Kroger employees that you asked. I think this is in some ways a good sign regarding the fact that we have more tests. Our system is working. Our epidemiological team in our Emergency Operations Center at the Department of Health will be following up with these two employees, but it's good that we know that their illness is COVID so that we can remove them from the workforce. There's no question that we all can and must do more. Later this morning, you'll see the amended order, which is going to be providing some specific outlines of what we require for social distancing. One of these items will be that we're not going to allow so many people into the store. They need to have enough space to allow the social distancing for people to be allowed in the store. We are also going to be following up specifically with each of these facilities as directly as we can, but we need all your help to learn best practices, maybe putting these X's down to give visible symbols of where people should be sitting or standing when they're online. Also, we want to see lots more wipes, and we're seeing this in certain facilities. So we're going to highlight those best practices, let people know what's required of them, as well as make sure that if people feel sick, they get removed from any of these activities. The take-home message here is we all, whether we feel sick or not, must view ourselves as potentially infectious, and everyone who we meet is potentially infectious. That means everything that they touch, everything we touch, could transmit that to us. Best message overall, stay at home, don't go out unless you absolutely have to. Thank you.
And Tosin, I will follow up with you after this, and we will connect with the United Way to determine the status of those grants to organizations that work directly with individuals to help them with financial assistance, utility payment, rent, and mortgage payments, and the like. Next, we have Ian Jung at the Tennessean.
Good morning, and thank you for today's briefing. I wanted to follow up on a few questions already asked this morning. When we talk about hospital capacity and we say that we are doing fine, I was wondering if we can give some numbers to that so we can kind of understand that picture currently. And then in regards to healthcare providers, is the city aware of how many healthcare providers have tested positive for COVID-19? And how does that relate to the concern of will we have enough healthcare professionals to meet the growing demand?
Dr. Junger.
Thank you. So regarding capacity, the state has a system called the HERTZ system, HRTS. I monitor that every day. Every day there is an update of how many hospital beds are in the state, and we can narrow that down to our region, how many vents, how many other supplies there are. That number right now of hospital beds available per percent is around 30-something. It obviously varies every day. So looking at it this morning, I was in the mid-30 range. I don't want to give you the wrong exact number. So that's that. So when I say we're fine, it is true that this moment in time, we are fine. As far as there's hospital capacity, there's vent capacity, there's ICU capacity. But any day, if we spike up in the number of patients that need hospitalization, that can quickly get washed away. That's why you, again, spread the word, not the virus, flatten the curve. That's what we're trying to do. In regards to healthcare workers, I was looking at Dr. Caldwell. The health department does know everyone in Davidson County that tests positive. The health department traces them, as I mentioned, with their great team of epidemiologists. Listen, healthcare workers are on the front line of this. I see patients, every week. We worry about it. That's why we have to be vigilant. That's why we ask for the public to help us. Stay at home, get the infection down. But healthcare systems in our city, I know, are worried about this as well, and they care about the health of their employees. And yeah, healthcare numbers are important. And like I said, they're in the Dr. Caldwell tells me right now they're in the 50s, 60s, maybe more. I don't have the exact number for you, but the health department could perhaps track you down track that number down for you. But again, you guys can do this for us if you just help us. You just stay home, all right? Because if one last point here is, of the numbers I provide you, I think almost half of them are individuals between the age of 20 to 30. These are typically asymptomatic people. These are healthy people that will go out and get others infected. So I know I'm saying a lot here today, but that is critical for me that that everyone helps us and protect our healthcare workers. Thank you.
We have time for two more questions. Kara Hartnett and Sam Zern at WPLN. Let's start with Kara.
Hi, thank you. I was just wondering if you could tell us how many reports you've had of people not complying with the Safer at Home order.
Dr. Caldwell.
We've had hundreds of reports. We'd like to have people refer any complaint to Hub Nashville. That's the way we can have it documented and follow up with it. My staff and those who are assisting us at the Department of Health respond to every complaint. We go out. Sometimes we find out that the businesses are complying. It was just a misinterpretation of the person who observed the complaint. Other times we educate people, businesses, and they didn't quite realize and understand it, and they find it that they immediately comply. We've had some circumstances now with the parks, working with the director of parks, Monique Odom, and her staff, that there's signs up, and if we get a report, that's immediately addressed. And we're trying to even be more proactive so that we can make it so that people are not tempted to use some of these places. So please let us know what you hear. We respond to everything, but we need all of your help to help us with complying with this order. So thank you.
And Sam Zern with WPLN.
Morning. This is a question for Chief Anderson. I'm wondering if the officers on your proactive units, like the Juvenile Crime Task Force, are changing their activity or protocols at all under the coronavirus, and what measures y'all are taking to keep your officers healthy and if you have a plan in place for when officers start to get sick.
Chief.
So all across the police department, we're putting precautions in place, and so that includes the Juvenile Crime Task Force. At this time, we have somewhere between 25 and 30. The number changes every day of people that we have out self-quarantine, awaiting test results, and we're being overly cautious there. So as long as staffing will allow, we're being overly cautious. We had 2 officers exposed last night, so we put them on a 14-day quarantine. And again, I'm watching what other police departments do across the nation, and different police departments have different protocols, but a lot of it is based on the available staffing. So as long as our shortage in terms of people in self-quarantine and is what it is and remains stable, I think we'll continue to be overly cautious. Nashville has done an extraordinary job of combating this pandemic. As bad as it is here in Nashville, when you look to other cities across the nation, it's in epidemic form. So I would urge everyone to comply with all of the orders. It only takes a few people to infect a lot of people. So that's the reason that you'll see our officers accompanying health department inspectors to make sure that that small number who are not complying gets the message, and we will only rely on citations and arrest when absolutely necessary. We've been very reluctant to criminalize what is otherwise lawful behavior, but we're at the point we need to step in and address those few that are not complying with the orders to stay at home or to not gather in places in groups and engage in activities that could spread the virus. One transmission there could lead to another and another and everywhere that individual goes. So that's what we need to address.
Thank you, everyone. A video recording of this broadcast will be made available later today. This concludes today's Metro COVID-19 press briefing.
This has been a